Добрий день, я вітаю.
Morning and welcome everybody who have joined us. My name is Ihor and I'm happy to welcome you in the Media Center Ukraine Vote today. We have welcomed you today to speak about an important topic, which is what we are going to be discussing is rabies. We will be discussing about the case in Ukraine. We will be discussing about the preventive activities of rabies in Ukraine. We will be discussing about the medical care and support. I'd just like to present to you our speakers for today. Today with us here, Ihor Kuzin, Deputy Minister of Health of Ukraine, Chief State Sanitary Doctor of Ukraine. Also together with Serhii Tkachuk, which is the head of the state's service of Food Safety Service of Ukraine and the protection of consumers as well. And together with us, Dr. Aron Aregay, acting head of the public health programs of WHO office in Ukraine. Welcome everybody, and I'm so happy that you've joined us today in this meeting with such an important topic. Dear Ihor, there will be a question to you specifically. Let's speak about a few things about the cases in Ukraine. What is happening? What is the epidemic situation? First of all, I'd just like to start from the fact that rabies is the acute communicable disease, which is in case of if somebody is infected with the virus, it causes lethal consequences. Therefore, now you have cases registered of the disease and most mortality because of rabies in 150 countries in the world. And Ukraine is also registers both cases of disease and also lethal cases. Therefore, we are mentioning here that in those cases are being registered about among the human population and animal population as well. And we need to understand here the algorithms of action of every single person who face or is probably or possibly can face was a case when there is a bite or there is a scratch or there is a saliva that happens to get on the wound, because being infected with rabies is not only happens in case if somebody bit you, this can also be like a scratch, and also if saliva drips on the wound, if the animal did not put any physical damage, for example, but there is a part of the body that has saliva on top of it, of the animal in question. Usually Ukrainians are reaching out for medical care for regular indicators, which is 58,000 cases a year, which is the Ukrainians encountering to request medical care in case of those. But anti-rabies support, so the specific immunization and injection of the vaccine, only for the 22,000 Ukrainians have been conducted, which means that all the other cases, by the doctor's assessment, is considered low risk. Therefore, they're not requiring immunization as a preventive measures for them. This is why here it's important to understand if you have a contact with an animal, there is a saliva dripping on your body or your skin, and there is a scratch or a bite mark, you need to reach out to the doctor so that he can do the risks assessment and prescribe anti-rabies support if the person needs it. There's also a widely spread myth on the vaccination, and we all remember from the childhood, this is 40 shots in the stomach, it's scary and all that. This is 5 shots, not 40 anymore, and a vaccination is prescribed only in cases where there is a high risk contact, when there's no info on the animal, when we don't understand whether the animal was vaccinated or not, when we don't have the capacity to track the animal's health after it has bit the owner. Therefore, the rapid encounter to the doctor, it's highly important so that medical care to be provided accordingly. And another important moment here is that so that effectively to be providing anti-rabies support and care. All throughout the country, there is a network of centers for anti-rabies medical support provision. Their list can be found both at the webpage of Ministry of Health of Ukraine, health departments of its respective oblasts. This is the centers where the anti-rabies vaccine is being distributed to, meaning in case somebody encounters there, they will have a doctor that can prescribe this treatment. And from the day one, from the moment of the person encounters the doctor, they would have the 0 vaccination, which is the first one from the number of 5 that is needed for the patient. And also another important moment here that's regarding the fact that unfortunately, but in Ukraine, we register both lethal cases among humans on rabies. We had 1 lethal case in last year. We also have 1 lethal case on the statistics in 2024. Irregardless of the bites that we have a year is still staying more or less stable, but we do understand that right now on Chernihiv Oblast, for example, Kharkiv, Zaporizhia Oblast, or due to the significant number of wandering or wild animals that is on the loose, or animals that was lost there. But the number of such animals grows, and so the number of bites can prognostically change by the forecast that we do, and this can possess a threat. We do register lethal cases that more so connected was that the person did not go timely for medical care and support, or just thought that this animal for a week or 2 or 3 is at home, and so there's no issue and they look okay, to reach out to the doctor. And also the last thing I wanted to mention, that what can be done yourself to the moment when you reach out to the doctor. First of all, in case of such a contact, what you have to do is to pour as much water as possible, or to water the wound at least for 10 minutes. And it's best to use with soap that are regular soap, that brick soap essentially, so that to inactivate any kind of virus that might get to that surface of your body or any mucosa. Then you can do the wound processing, and then you can reach out to the doctor so that you can do the assessment needed. This is the least amount of actions that you need to do to any Ukrainian if they face such a case or with such an issue in their practice. Ihor, can we touch base here a bit to about the doctor issue? Who do you have to reach out to? Is it the family doctor, or is it better to look for on the map, on the web page that you have, the info on the centers that are doing the vaccination and reaching out to them? So what is the correct pathway? It's better to have a look where you are, and so to find the nearest anti-rabies support center. This is the simplest option, because you'll be right away going to the place where there is a vaccine and where our doctors specialized in that. But if the person is an IDP, or they're the first time ever at this point of care, then usually this is the admissions department of the hospitals, or orthopedics department or surgery department of that hospital that provide for the function of attending physician. Usually this is the district level hospitals. Then their admissions department, they would have a room for that. Usually this is a strong network for treatment that covers almost all cases. We even have the district level hospitals that are in the villages are covered. So if we are mentioning about regions, right, so that in each region we will be able to find this kind of center where you can get this vaccine, and so this vaccine would be there present. Yes. Right now in the country we have over 50,000 doses of the anti-rabies vaccine, and this number has been given to us by the international partners as a humanitarian support. This number is fully enough to do the adequate number of courses for anti-rabies support for the patients that's being distributed already. And so there was a question about the time. How much time do you recommend, and how much time does the person has to reach out to the doctor and to get this vaccine? To be honest, how fast you are reaching out, it's also dependent how fast the doctor would start immunization, and the rapid onset of vaccination is a key to success. It's better not to delay any time ever, not to reach out in a week or something, but to go after right after the same day if something happened. If it's impossible to get out there, it was the minimal possible time difference from the moment of the bite to the moment when you get the vaccination. So it's not recommended to delay it for the next day, or for to assess your symptoms yourselves and to think that the next day you're going to be better, you're going to be feeling okay. And so rapid onset of anti-rabies support and a rapid onset of vaccination itself would be saving lives of people. If this is the case when connected with being infected with rabies, how important is for a person to know which animal it was? So how important is that? And what do we have? What kind of info we have of this animal has been vaccinated? I think this is the question to Serhii, because he can tell you more about the animals as well, and what the value is of the animals in this case. Okay, Serhii, can we have a quick talk on the animals and what is happening there, and how provided we are with the vaccines, and where you can get them for animals, and your recommendations to the ones who are taking animals in and all that? Greetings, and the topic is really acute for us, and we can also state that rabies in Ukraine is only growing. This is true, and for that there is many factors connected with war in Ukraine and absence of anti-epizootic events in 2022. I would just like to state that the government has fully funded and allocated funds to procure those vaccines. The vaccines on anti-epizootic activities, there's two times. So there is per us or per what, essentially the ones as the king or not, before it was then spread through the aviation to spread among dire animals like with raccoons or foxes or anything else. And the second type of vaccine that you vaccinate individual animals for in-house cats or dogs, it's also an important part here. And also by being able to reach out to the citizens that you have to be cautious, you have to be aware that you have to vaccinate your pets that you hold. And so it's unfortunate to say that we are stating that the household animal have rabies. This is a threat to everybody surrounding for the person who holds this animal as their own. But this year we have detected a lot of rabies cases among the household pets. Apart from that, it's important to understand here that if you detect rabies in animals, this is accessibility for the healthcare system response for the treatment needed for the human that had been in contact with such animals. The methodology that was used before, I'm not going to touch based upon it, using like mice and everything else. This is just the confirmed case, which goes for around months. But for contacts, there's a different methodology for that, and we are working with the support of the WHO office in Ukraine and in different international partners to just get to the diagnosis of rabies among animals by using also PCR testing in our labs, which would increase this velocity of our results issuing, and so would also allow us to have the risk level for any particular case so that the healthcare system itself would be able to then state whether any other measures are needed or what is the treatment procedure for in that case. Do you need to vaccinate a person or not? And this is important in such cases. And so in this system, we do play our own role, and we want to change a few things so that we can provide the higher speed or rapidness of response, because this is a prolonged period of time, but this is possible. We are doing that. We made a plan so that at the end of this year, we'd be able to diagnose in our lab network, not in all of it, but at least in a portion of that by using PCR methods for rabies in animals. Apart from that, one of the reasons why it spread so much, this is many wandering cats and dogs, but also a significant portion, it goes because there's no hunting right now, there's no other types of activities. There's a growth in the foxes population. This is a critical thing that we unfortunately have to face. And so right now there's a spring campaign on the vaccination, and what is that specifically? Now, all the means and measures necessary have been included also from local authorities, military, civilian administration, our forestry agencies, and everybody who is close to that one. And so that for the full May, on 13 regions that are in this spring campaign, there is unfortunately, we do this by hand, this vaccine, because the aviation is closed. We can't use any aviation means to do that. And the portion that we did, we made an ambitious plan to increase at least 2 times the number of doses and the area covered compared to where it was done before in 2023. This number, and we calculated for the 2 campaign, also for spring and fall campaign, to make 9 to 10 million doses throughout the country. To this fall campaign, we have all the regions included now. Because of the restrictions, we are not working in the frontline regions because of the safety concern. Into the fall this year, we'll be able to see what we can do. All the other regions are being included, and so this campaign has been started. On where you can vaccinate, for example, for household pets, then our system for veterinary clinics is also present on our webpage, so you can find it there. And also, if people for some reason don't trust the vaccines that the government has in their state system, they can also do this in the private vet clinics that had the licensing. Their network is quite vast, but I'd just like to reassure you that either the private vets or official clinics, they do with the registered in Ukraine the vaccine. We have 2 state manufactured vaccine registered and also 10 internationally manufactured vaccines that are registered in Ukraine that you can do this kind of vaccination with, so that the conscientious citizens, we are reaching out to them and we are trying to do this awareness raising campaign, and also international organizations that are doing that have joined, which I'm so grateful for, in the info campaign to the WHO country office in Ukraine that right now is doing a lot, and I'm sure that we will have a lot of joint events back then so that the conscientious citizens will be able to do that. Their household animal, and it's really hard, when we are fighting dire animals, when our citizens are not doing the bare minimum or any kind of activities with the animal that they're in contact daily. Therefore, we think that this is highly important, and we would just like to, together with the mass media, to bring this to every single citizen that is holding such animals, that this is worthy of doing, because this is not safe for such people, and also for neighbors or children. This is highly important. The issue is that maybe citizens don't really get, and we had some of the cases, and I'm so grateful here to National Police Forces of Ukraine that actually responded timely. So when does the bite of the household pet is coming and there is a confirmation that this animal was having rabies, this animal some of them becomes the owner less. We understand that it's not that hard to, on the small district, to know who is the owner of the dog or cat if they actually moved out, so the neighbors know whose dog that was, and so such people, if there is a lethal case, this is the criminal offense for the owner of such an animal. So here, National Police System, they're also responding, and we think that this is highly important, because you think that our citizens think that there's no responsibility for it. It's not, if everything's okay and if negative consequences happen because of them. If somebody lost a life or house or livelihood because they did not vaccinate their own animal, this is going to be proven that this is their animal, then there is a level of responsibility foreseen by the legislation, and everybody's interested in working on that so that such people would also be responsible for what they're doing. How much does this vaccination cost? I'm not ready to tell you how much does it cost in the private veterinary clinics, because there is a different vaccine cost differently. They have services and there may be observation something. In our system, this is done for free. This is why you can pick like any vet clinic that is foreseen or present on the webpage of Food Safety Service, and to just reach out to that. We do have the vaccine present by the government there. This is why for the citizens that will bring or a cat or a dog, this is going to be done for free. Okay, what does the statistics tell us about the rabies incidence among animals? Is there any numbers? There are some of the numbers I did not bring into the head, but I can just make an example, a few of the examples. This is the specific statistics, and they're really outreaching. If you take the first quarter of 2021, we had only 190 outbreaks. In 2024, 300 or something, and it's only in the first quarter of the year. If you would take for the past year, for those sanitary unfit regions, we have over 1,000. So the first quarter that we mentioned before is 369 already, which means this is a significant level of growth, and we understand that if this trend stays, then this year we will have a lot of the unsanitary areas in Ukraine will have much more than last year. Therefore, everybody's required or have to use means and measures necessary to prevent the spread of such a disease among the also wild animals and also domesticated ones as well. Are there any regions where you note like an outbreak of sorts, or is this? So it's different region to region, but almost every region has an outbreak for rabies. We do understand that somewhere it's hard to note it down in frontline regions, but we do understand that there's more of them and they are being noted down. There's no region where you don't have a rabies case. Let's remind our viewers and pet owners how this kind of vaccination was done, and so this is just once a year or not. If household animals just once a year, and then this is a campaign on the wild animals or the conduct on the epizootic activity, and that there's two campaigns this spring and fall. I'm so grateful, dear Aron. The question is to you. Let's talk a bit about the global dynamics, essentially, of rabies in the world, like how this dynamics you see, like what does it look for Ukraine as a part of the world, and what kind of global initiatives are present at the time to combat rabies in the world? Thank you.
Yeah. First, thank you very much for organizing this event. I think it's part of the awareness creation that we all, as partners, want to bring to this public health issue. So to answer your question, globally we have on annual basis, on average, more than 59,000 deaths from rabies, and mostly from dog bites. And this is basically, if you take it the numbers, it's pretty much 1 death per 9 minutes. Every 9 minutes you have 1 death, and 40% of this mortality is among children which are aged 15 and less. And this is known because a lot of dogs and pets stay more exposure to children than adults, and that is one of the major risk group when we see rabies. And the second is looking into the economic impact on the healthcare system. Already Serhii and Kuzin has been already explaining how the prevention and response is happening, and that is huge. If you only see, for instance, the post-exposure prophylaxis that globally has been administered for on annual basis around 2.6 million, which costs close to 8.5 and plus billion dollars per year. So this is huge cost for the public health when it comes to the response side of things. And this is why it's quite important to invest our resources and time and expertise in the prevention, because if we avoid the exposure, which is one by vaccinating our pets, if we reach into, let's say, 70% plus coverage, then we have a very less chance of having any rabies outbreak in our community. So the investment that we make in the vaccination is much less but more effective, and you avoid the significant investment on the post-exposure prophylaxis. And the second component to this is the community awareness. We have been working together both with the Health Ministry of Health as well as the State Service in creating community awareness towards A, vaccinating their pets, but B, also whenever there is any incident of exposure, then where to go and how quickly you should go to the near healthcare facility. I'm sure you have seen this poster that we have distributed, where you have the QR code both for the where to vaccinate the pets as well as where to get the vaccination, the post-exposure vaccination, if something happens to the exposure. So overall, I think it's a dual track that we have to follow. One, creating the awareness, and two is the preventive measure that particularly focusing on vaccinating the pets.
Докторе Ароне, буде питання.
Aron, there is a different question. There's also a question on the Ukrainian protocols on the response for babies. Like, how do you see them? Are they in line with the international standards or not?
Yes, so I think the first thing that I think we should appreciate is rabies is one of the public health risk that cuts across both the animal and the human health. So as we call it in public health, the One Health approach is quite key. You cannot tackle the public health crisis if it reaches that level without engaging all the different stakeholders, which is in this case the animal health as well as the public health. So for the first time last year in 2023, understanding the challenge of this multi-sectoral approach to rabies, we have brought all the stakeholders together to have the first rabies conference, where we outline all the different challenge, but as well the progress. And when you see where Ukraine lies vis-a-vis the global trend, Ukraine is not off track from getting the target, which is by 2030, we want to have 0 case of rabies from particularly from dog medicated rabies cases. And we believe that Ukraine is on track to achieve this target, which is globally brought into picture, including FAO, WHO, the Animal Health, and as well as the Rabies Control Global Alliance, towards creating this awareness at a global level. And we are strongly believing at this stage that Ukraine is on track, and that's why we are starting to start implementing this initiative of eliminating rabies by 2030 in Ukraine, in priority oblasts where we can see and learn the lessons. So to answer your question, Ukraine is on track to achieve this target of the global eradication.
Дякую вам, доктор. У нас є відео, яке
Thank you so much. We also have a video from you that we can watch, and then we can go to questions and answers. So thank you. Welcoming to the happy meetings with animals. It's important to understand the behavior of domesticated and wild animals, and also respect its borders, essential and boundaries to avoid something as fearful as rabies. So cats, dogs, and other animals, they bring us joy, but for a safe kind of relationship, you have to know about the few rules. Both domesticated and wild animals can scratch you or bite you, so never touch an animal when she's eating or sleeping. And so let them approach you when they feel comfortable with that. Just if you want to reach out to them, do so calmly without any rapid movements. Always ask before touching another person's animals, trying to keep a distance with unknown or wild animals, essentially. Vaccination of household pets are needed for their health and safety of our households. Regular vaccination protects them from diseases like rabies. Greetings in our clinic. Let's take care from your pet to be healthy and protected. Vaccination is quick and not painful. The signs of rabies is active salivation, aggressiveness, or paralysis. By meeting wild animals, always remember that they have their own instincts and their own types of behavior. Just look at how pretty she is. Let's just enjoy its presence without obscuring its presence. The contact with infected animal creates a risk for rabies. Rabies is an important condition that you can be infected by saliva, bite, or a scratch, and sometimes from mouth, eyes, or open wound. Rabies infects essentially brain and nerve tissue, therefore it's really dangerous. If the animal bit you, just stay calm and stay safe. Just move out. Just try to wash your wound with water for 15 minutes and put the clear gauze. If you don't know if the animal was vaccinated, just reach out to the doctor. Even if there's non-significant scratches or bites in humans, they don't have symptoms right away. The development can be prevented of those symptoms by the vaccine. Care for animals, wild and household animals, and so respect them, and so our world will be harmonious and good for all. Dearest colleagues, if you do have questions, please do go to questions and answers. Greetings, Ukrainian forum, it's Serhii, and I have the question to Serhii. You mentioned before that the pet owners can for free vaccinate their pets and animals. And so is there a specific number of those vaccines, or are there just constantly refilled of those in those vet clinics? Since I know for the pet owners, especially through the elderly people, they just don't know, they don't vaccinate their animals anymore because they are afraid that it's costly, or they're afraid that it's going to be too expensive. We know how much it costs in the private clinics, but not everybody knows that this can be done for free in the state clinic. How many vaccines is being given to the household pets vaccination? So there is enough fund dedicated for the vaccination of the household animals. And so specifically this year, it was around 60 million hryvnias just for the vaccination of the ones that are used for the household pets. And they're always present. And also if there is a need, it's being formed by putting a budget request in, and we can increase this for next year. And so this year, if for the state budget is being financed, also I can make sure that we are getting also from WHO, from FAO, from USAID, from other partners, that in case there is a need for that, they can give us those vaccines additionally as well. Therefore, we understand that the capacity of food safety service to provide in our vet system and to provide for the presence of this vaccine. And so I can, for example, name the following ones. This year from FAO, we received test kits for the rabies diagnostics. We never happened before. More than 120,000 of such a test we would be able to be done. Yeah, we did plan for that this year, and so we will save them. And so this is more than 20 million hryvnias. FAO is giving us this number of test kits. And so the readiness to provide the vaccines, also international partners allow us to invoice the full readiness. And we understand that if you'll spend all the vaccines and procure everything that's for the state budget, then potentially we will not be able to get the state funding. But we are fully concerned to get this vaccine from our international partners, for example. Therefore, if there is a capacity, and we are urging so that people would reach out and vaccinate their household pets. Do I understand correctly that you can vaccinate not only cats and dogs, but in your vet clinics, but in the state, meaning, but also the animals like raccoons or foxes, because now it's really popular to have also those kind of animals at home. You can vaccinate the animals that are through which there is a spread of rabies, and so raccoons and foxes are also regards to them. So I can't really state that the household pets, there is a statistics that people are using that I don't have that are having a raccoon or a fox. But if there is a request like that with such an animal, I'm sure that we can provide for its vaccination in our system. You also have the question, analytic refracts Ukraine. I'd just like to clarify from Ihor Kuzin on the number of vaccines. You said that there was a need of 22,000 of the ones who've been prescribed the vaccine, and in Ukraine right now there's 50,000 vaccines. And so if you would to do the the vaccination for each that was done there, that we are lacking half of them. You did calculate correctly for one course, and for one human being there has to be given 5 doses of the vaccine. As of now, 50,000 is being brought. This is from the humanitarian aid because of our partners, so in WHO, for example, and in the nearest months we are expecting additional procurement for this from Medical Procurement Ukraine, or MPU. Now this supply, it will be enough to the April 2025. So this is the mixed budget, and but it's a significant number to provide medical care for all. Greetings, Olga Bondarchuk from ICTV. Can you tell us a step-by-step way on what you do if if you suspect rabies? So what would you do when you after you get the vaccine? Can you go in details on what do you do as a patient? If the patient had a contact with an animal they have to at least, as soon as possible, wash it with water, with the use of the regular soap from 10 to 15 minutes. After which, you need to find the info on the nearest point for anti-rabies support. This can be in a hospital, or this can be a surgical room in the nearest healthcare facility. As soon as the patient reaches out to there, they have to go as soon as possible, reach out there, so the attending physician would get the assessment of such a patient. During this assessment, they note down the place, so where the bite was, or what are the cases that, or what are the things that led to the bite. So there is other questions are being asked, and what is needed by doctor to do the risks assessment. And then they make a medical conclusion on the prescription or non-prescription of anti-rabies support. If the patient needs any surgical intervention, like to stitch the wound or primary surgical processing, so in this place, they're providing this service from the primary surgical intervention. And if anti-rabies support was not prescribed, then the doctor informs the public health system on the fact of the bite as such. And also in parallel, the patient is being let go to home with a general recommendation on how to process the wound in the household conditions, with the need to get back in a week or through another period of time, so that they can be regularly observed and to see if the wound is being closed and anything like that. If there is an anti-rabies support given, so that the first vaccine is done at the day of the encounter, which is called the 0 dose. Then it's done on the 3rd, 7th, 14th, and 28th day. And so those are the days when the person has to get back to the same point of vaccination, or if they moved out anywhere, and to get this course of vaccination elsewhere. And so they are getting the vaccination in the same place of anti-rabies support center. And so as soon as the course is being finished, the patient is called fully vaccinated. This info is being given into his patient history. They're not under following observation. The only specifics here, that if this person of advanced stage, or there is a risks that they might have a IFE or adverse effects following immunization, they can be done in case of inpatient care. These cases are happening, and this is an okay practice in cases of those presence of inpatient support. Thank you so much. We do have another questions. Yes, Ukraine in Linus Unglaeva. So you said that the rabies is growing. If you compare it to the last year, what is the statistics? And regarding the vaccination of pets and everything else, it has to happen 2 times a year, right? Or what is like happens? Is there like a program, or like how often do you have to do so? So the vaccination of household animals is done. It's enough to do once a year to vaccinate them, but the campaign that is the state campaign essentially on the conduct on anti-epizootic events. There's many diseases that we do this for, and then it's done twice, so that the spring and fall campaign, this is that all the central executive bodies are involved to kind of combat with the wild animals, with foxes and everything else. So this is the vaccine that's being just placed in the it's placed in the forest so that they can consume it, so that you don't have to do that for your household pets. Just do once a year. What kind of statistics on for rabies itself? So among humans, then among animals, on the first quarter, we have over 339 villages or settlements. So those are the animals confirmed to have rabies. If you were to compare it in the first quarter of 2023, there have been 109 such settlements, and altogether there have been around 1,000, meaning where there is fully confirmed 100% of the cases of the animal that you've been in contact with had rabies. Dear Serhii, on the first vaccination, if the person decided to buy as household pets, like when does it has to happen? Let's give them a piece of advice so people would know. I know that if, for example, a person bought a pet, they need to understand like whether it was vaccinated or not initially, and also there has to be like a passport for what is the age of that, and if you can confirm that, then there's no information, then to vaccinate as soon as possible for that household pet and animals, because they were asking about the protocols, so the protocols and the treatment and then healthcare, like there is for treatment of the human being, that for animals confirmed or there is suspicion, there is no protocol for its treatment. They're not being treated, and we understand that the household pets for many people, they're just like parts of the family, so they might understand that they are just gonna lose them if such a case happens. Thank you so much. If you have any other questions, please do let us know. And so, yeah, please do go ahead.
Question raised about the increase in the risk of rabies. I think one of the challenges we have now in Ukraine is increasing number of stray dogs, meaning that when you have all the dogs in or pets with owners, it's much easier to do the vaccination. Where the challenge lies now is you have an increasing number of stray dogs. When we plan for vaccination, it's quite difficult to trace them and vaccinate all of them. And the additional layer of the challenge is a lot of the hunters and associations, for instance, could help you with vaccination when it comes to stray dogs. But in many parts of Ukraine now, because of the martial law, we are not fully engaging them to do the vaccination because they are not actively hunting. So I think understanding the peculiar challenge that we have in Ukraine is the increasing number of stray dogs means that you have more difficulty to also reach out and vaccinate. So just to add to that.
Пане Сергій, наостанок питання щодо того, наскільки
Another question, how important this is in cases, Serhii, if we were bitten by the dog or by the cat, how important this is to have to test this animal where it was, like what's important for us to know and what's important for us to do or to test this animal. So it's really important to state how this animal is, because to have that, to confirm that or not confirm that, it depends on the voiced by Ihor treatment protocol. So we understand here that if this is happen in the wild, then the contact with this animal, there's nobody gonna find it. So the healthcare system still thinks that there is a suspicion, and you have to watch the person, and so that you just do this. It's depending on the high or low risk level of risks, and so the health response would also be depending on that, on any kind of consequences. So if, for example, if a fox bit you and run away to the forest, nobody will be able to find it specifically. So what are the chances to get a fox that did this bite? So it's impossible for us. And if this the animal and the household animals, or just the wandering, but it's just staying somewhere, this is possible, and this can be done, because this is the diagnostics of if there is rabies, and if there's no rabies, trust me, this really calms down the person, and from another side will prevent future or following people that can stay in there and might have a contact with that person or with that animals. This is why for us it's really important the animals, and to diagnose it if possible and confirm or disregard the presence of rabies. And so if the animal is vaccinated, we can be safe. If the animal was vaccinated, we can be safe and sound. Thank you all so much for this broadcast. Thank you so much for being showing interest in this important topic. And I'm really hoping that both for the scale of Ukraine and for the scale of the world, we will be able to fight rabies to the bone. And so thank you so much. We are working for the victory of Ukraine. Thank you all so much, and have a blessed day.